Hello everybody, this is Gary. Today is Monday, March 14th, 2022. It is 11:40 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my anxiety levels are very high. I'm very nervous. I'm very agitated. I'm very unsettled. My paranoid levels are pretty high. My delusions are pretty strong. My auditory hallucinations are pretty strong. My depression is pretty severe. Um, I'm very depressed. I'm very nervous. Very anxious. My thoughts are racing. I did get a good night's sleep last night. Insomnia hasn't been much of a problem, but my auditory hallucinations are pretty intense today. I'm doing the best I can to cope. I'm scheduled for physical therapy today. I'm at 2:30. I believe it's the last appointment I have for physical therapy. I will continue the physical therapy exercises on my own that I've already been given over the past 4 or 5 weeks. Tomorrow I have group therapy for dialectic behavioral therapy, which is a form of psychotherapy to help people with mental illness deal with high stress situations, both internally and externally. I don't want to go to the psychiatric emergency room. It's very confusing and even violent there sometimes. It's overcrowded. It's confusing. It's chaotic. And I would rather not go. So I'm just going to keep my physical therapy appointment today. I'm not suicidal or violent. I'm in control of my own behavior. But all my psychiatric symptoms are pretty intense today. My physical pain isn't that bad. I started on Cymbalta 4 or 5 weeks ago. It's an antidepressant, but it can also be used for physical pain. I'm using it for nerve pain, muscular skeletal pain, joint pain, arthritis, muscle spasms. I'm also taking Flexeril for muscle pain, Tylenol for joint pain, Aleve for joint pain and arthritis pain. I'm taking Neurontin for physical and nerve pain. So I'm on several different medications for pain. The pain isn't that bad right now. I'm doing okay physically, I think. It's just that my psychiatric symptoms today are very intense. I just saw my psychiatrist last Thursday. We did not change any of my medications. We did agree to continue the Klonopin 0.5 milligrams twice daily indefinitely, and we didn't change any of my other medications either. I have a primary care physician appointment coming up on April 6th. We're going to go over how my physical pain has been doing, which has improved greatly over the past 4 weeks, probably because of the physical therapy as well as the Cymbalta and the other medications I'm taking for pain. Physically, I'm generally okay. I'm in good health. I'm still overweight, and I'm still taking medications for high blood pressure, but I haven't had a cigarette in about 9 weeks, and I'm using nicotine lozenges to stay away from the smoking cigarettes. So that's going okay. I'm not damaging my heart, my lungs by smoking cigarettes or using any tobacco in any form. My breathing has gotten easier since I quit smoking, although I'm still very, very heavily addicted to nicotine. I'm not sure when I'll be ready to try to get off nicotine, but this is not the time. I'm under a lot of stress. I'm under a lot of pressure. I'm very busy, and I do try to stick to my daily schedule, like making these videos. I'm doing the best I can. So that's all the report for now.